I'm Dr. Atrium, President and CEO of the MetroHealth system, and it is my pleasure to welcome you here today. Thank you for coming on this snowy day. Today, you will hear how MetroHealth and the state of Ohio are preparing for a potential outbreak of COVID-19 or coronavirus. I'm joined here by Governor Mike DeWine, Director of Ohio Department of Health, Dr. Amy Acton, Cuyahoga County Health Commissioner, Mr. Terry Allen, and MetroHealth Chief Quality Officer, Dr. Brooke Watts. For more than 183 years, MetroHealth has been managing health crises that spread fear and alarm throughout our region. It all began with the Cleveland cholera outbreak in 1837. This was followed by a TB crisis in the 1900s, and later the polio epidemic of the 1950s. In the 1980s, we spearheaded efforts to address the spread and treatment of HIV and AIDS when contracting the disease was a death sentence. And when Ebola hit our shores 5 years ago, we quickly volunteered to become the state's only designated Ebola treatment center. Today, the center includes a special disease unit that focuses on emerging disease threats. We stand ready to treat COVID-19 should cases appear here. The Governor and Dr. Acton have met with our team and visited our special disease unit. We've discussed our preparation for COVID-19. We are honored to have Governor DeWine here. He has been a friend and ally when he was in the United States Senate, and a strong partner on the opioid epidemic as Ohio Attorney General. It is reassuring to all of us that this governor understands the health needs of Ohioans and that strong safety net institutions like MetroHealth are critical to Ohio and the United States. We are the first line of defense against emerging disease threats. Ladies and gentlemen, it is my privilege to introduce Governor DeWine.
Thanks, Doctor. Dr. Boutros, thank you very, very much for having us here today. We just finished a tour of the Emerging Diseases Unit to learn more about the preparations that are occurring for infectious diseases such as the flu and the coronavirus. What they do here at MetroHealth is certainly very impressive, and Ohio is fortunate to have doctors, nurses, epidemiologists, and others committed to protecting our health and well-being from the spread of diseases. We are very, very fortunate to have that. So, Doctor, thank you very, very much. After I was elected governor of this state a little over a year ago, I asked Dr. Amy Acton to head our Department of Health. Since the beginning of the news about the coronavirus 6 weeks ago, Dr. Acton and her team at the State Department of Health have been engaged with our local and with our federal partners, preparing for whatever might come next. Dr. Acton updates me at least once, sometimes many times, every single day. She briefed our cabinet this morning again. And she has just returned last night after spending the last several days in Washington, D.C., where she has been working with her counterparts across the country, as well as officials from the Centers for Disease Control and Prevention, the CDC, and the U.S. Department of Health and Human Services, and the White House. The threat of the coronavirus in the United States and in Ohio remains low. And currently in Ohio, we have no confirmed cases. We have no confirmed cases, nor any persons under investigation. We have had 7 people tested for the virus in Ohio, and all of these individuals have tested negative. But we know that this could change. And so we have to be prepared. And all Ohioans must have a sense of urgency about this emerging health threat. And that's what I want to talk about today. It's imperative that we be open with the public and that we communicate information in real time about the coronavirus to both inform and educate the people of the state of Ohio. My commitment is that we will communicate what we know when we know it. That is our obligation, and that is what we intend to do. Certainly today, no one knows all the answers. No one does. Dr. Acton will share today with you what we do know so far, but we certainly cannot predict the future. And this disease continues to evolve, making it all the more important that as things change, we continue to work with our local partners to communicate information to the public. In Ohio, our Department of Health, our State Department of Health, works directly with 113 separate county and city health departments around the state. We work very closely and collaboratively with these local departments. They are truly the first line of defense in every one of our communities. The State Department of Health works with our local partners to provide guidance to them, to provide virus, but also the flu. Because the fact remains that Ohioans today are at a much higher 16,000 flu deaths in the United States so far just this season. And that figure might be as high as 41,000. Flu remains a major killer in this country. While we do not have data about how many adults have died in Ohio from the flu, we do know that there have been nearly 1,200 flu-related hospitalizations as of February 15th. And tragically, 2 children, both young girls here in Northeast Ohio, have died from the flu this season. A 16-year-old in Cuyahoga County and an 11-year-old in Lake County. As I said, the adult numbers in Ohio we do not have. And so as we outline the steps Ohioans can take to protect themselves from a possible coronavirus outbreak, it is equally important to take these very same steps to prevent the spread of the flu that we know is already here. Today, I have asked my cabinet directors to implement several very important steps in their agencies to help mitigate the risk of both the flu and possible coronavirus in Ohio. As a state, I believe that it is important that we lead by example. And so what I'm ordering today, I hope, does that. As far as the state is concerned, we run institutions, buildings, 2 veterans homes, 6 state hospitals, 9 lodges at our state parks. We have 28 state prisons in Ohio. So we have an obligation to ramp up what we are doing and to have that sense of urgency ourselves about what I'm asking all Ohioans to have, and that is that sense of urgency in preparing for what may be coming. So, here are some of the things that I'm ordering today. And I strongly encourage everyone else across the state of Ohio who runs businesses, who runs hospitals, nursing homes, schools, and other facilities, that if you haven't done these things already, to examine your existing disease prevention plans and consider additional measures. Now is a time to review what you're doing. Once again, now is a time for a sense of urgency. I am today directing the Ohio Department of Transportation to post information from our Department of Health in all state rest areas on hand washing protocols, and to include messages on Ohio Travel TV. I'm asking our Department of Rehabilitation and Corrections and the Department of Youth Services to increase the frequency of and be very aggressive in the use of disinfectant measures in all their state facilities to protect the inmates, the families, and the staff. I'm calling on our colleges and universities, our college and university leaders, to urge every student, every faculty member, every employee, that if they have not yet received a flu shot, to do this immediately. Go to the campus health clinic and get these shots today. Further, I'm asking our college and university leaders to prohibit college-related travel to nations where the CDC has recommended no travel, such as China and South Korea. And for all Ohioans, please consider your foreign travel. Anyone thinking about foreign travel should monitor the CDC's travel advisory website for updates. This is updated every single day, and as this virus continues and what we know about it continues to emerge, this information, we can bet, will continue to change. Monitor the CDC webpage. It's very important to do that. I also am asking our colleges and universities to take appropriate action. That meeting will focus on those things and more. Let me conclude by urging all Ohioans to help. And I know Dr. Acton is going to talk about many things that average Ohioans, all of us in our daily lives can do. But again, the basics. Wash your hands, avoid close contact with someone who is sick, and stay home. Stay home when you are sick. Something that some of us find hard to do, I think. I urge Ohio employers and schools to be flexible if people are sick and encourage people to stay home who work for you. These are simple and effective ways that all Ohioans can help. Let me now, at this point, turn it over to Dr. Amy Acton, who, as I said, has really been immersed in this for the last 6 weeks, and someone who brings in her training and background, a great background to lead our efforts in regard to the coronavirus, but also what we do every single day and our departments do every single day in regard to public health. Amy?
Thank you. Thank you, Governor. Thank you. Good afternoon, everyone. You see me a little sleep deprived. As the governor said, I just got back from D.C., where I spent a couple days really at the White House, talking to leaders there, working with the leadership of the CDC, and most importantly, talking to other states. It's wonderful to be here at a place that this hospital is so amazing in their work on infectious disease. So at the end, I hope reporters will also take time to learn more about what they do here. But I want you to know that our state stands ready. I know I say that, and I know at a time when there's a lot of information flowing and seemingly changing information, it makes it harder for people, everyday people, to feel secure in what's happening. But this is something we really are prepared for. Infectious diseases are something we know. And even when there's a new infectious disease, they are predictably unpredictable. In other words, pandemics and spread of infectious disease happens in a phased way, and it happens in patterns. And so we really, while we might not know exactly where it might spread first or where the one case in Ohio might occur, we really know what to do about it when it happens. So I want to let Ohioans know that this system is working. And in fact, in looking around our country, I felt that we are very prepared. We've taken a very conservative, sort of aggressive approach, as is my nature, and we'll tell you more about that, especially in the question answer. I want to answer a lot of details. But I want to think about what this feels like for people at home who might see this or hear about what you write. Again, coronavirus looks very much like the flu. What we now know, and we learn more hour by hour, is that it's very contagious. It's particularly catchy. In terms of its morbidity and disease state, it's a little more dangerous than the flu, but it's not as dangerous as things we've seen in the past, like you have dealt with here, like Ebola or SARS or MERS. It acts like a flu or cold. You have the symptoms of coughing, fever, body aches, and work with these amazing disease detectives, what Terry is going to tell you about here at the local level of global migration and quarantine, and then we share them with the local counties. About 33 counties have had a traveler that we know of, sometimes one, sometimes two, but that number will grow if we see more guidance about travelers from other countries. So that system is working. It's working very well. But if we had a case, we would come to you right away. So what would a case look like? Again, most of the cases in this country are at home. They're being monitored at home very similarly as to the people we suspect. They're not sick enough to be actually in a hospital. Right now, there is one person hospitalized. We know that most people will be miserable and take comfort measures like we do with the flu, but eventually it will pass. When it gets worse, they have respiratory distress most often. Sometimes in other countries, they've been put on a ventilator, and that's where you see people having more severe symptoms. But right now, the disease is really looking a lot like the flu, where you get that spectrum of people, mostly people who do well, but some people who might not. So that's my best way of explaining to you what it will look like when we see a case. Importantly, we surround that case. In a way, we take histories on folks that you wish your doctor still took on you. We ask you everything you have done, what you eat and drink, where you have traveled, if you sat on an airplane, what seat you sat on. We know everyone you have come into contact with. And then we go to those people you have come into contact with, and we talk to them. And some of those folks, like your family members, might be asked to self-quarantine and stay home as well. And we take those rings of knowledge out. Someday there might be a case who went to the movies, in which case we would publicly say that. We would say they were at the movies and saw, Spider-Man number whatever, and they were in this theater, and then people who were worried about that would have that knowledge so that they could go to their healthcare provider. The important thing about all of this is we will learn more hour by hour. And it's most important that you get your information from a good resource. So we have created, in addition to our usual website, we've made a more public-facing version of it called coronavirus.ohio.gov. And we're going to be putting on that lots of tips for just all citizens. Already on our website at odh.ohio.gov, we have tons of guidance for hospitals, businesses, schools, universities, kindergartens, daycares. And every time we get more guidance or learn more, have better tips, we put it on there. So I think it's very important in Ohio that we all go to the same information and all work from the same playbook. What are some of these things you can do? If you have a little prepper side in you, or just do what a lot of us do. I grew up in Northeast Ohio, and I kept in my car my blanket and my flashlight and my kit of things. What would your kit look like for coronavirus? So what you would think about is, what would it be like if you got sick and you didn't want to go to CVS because you don't want to expose other people? So you want to now, just make sure you have your basic cold symptom, kind of flu, aspirin, NyQuil, if that's your comfort measure of choice, whatever that is, you want to have those medicines. But more importantly, you might want to have whatever your regular medicines are. a 14-day at least supply at home. You'd want to have some food. You might want to think about your pets and make sure you've stocked up on pet food in case you're all of a sudden getting the vacation quarantine experience. And you might also want to think about your kids. You know, a lot of us have kids, and your kid might get sick and be sent home from school. So you want to be thinking about what your plans will be in that case. Also think about your parents or your grandparents. Will they need extra help, and what you might do? So if you're hearing what I'm saying that you would do a lot of the things you would do worrying about your loved ones getting the flu and having backup plans. Again, information is just so important. You will work with your provider. You will work with someone from the local health department who will be giving you guidance and calling in on checking on you, so you won't be alone. That's the other thing. You will have more help than you've ever had when you got sick if you get coronavirus. Eventually, you know, what else will we see here in Ohio? You know, I prepare for the worst, so I'm going to share a little of my, what I think about and what I see coming and what my colleagues are really planning for around the country. You know, we will see shortages of some of the preparedness, the PPE, what we use, the masks, the N95 masks, the gowns. There are worries about that already. We have a stockpile in Ohio that when they implemented twice a day, 20-second hand washing in schools and wiping down surfaces, because this virus is easily killed by just routine cleaning products, there were 50% less cases transmitted. It was that less transmission. So it actually is something that works. What we're trying to do is just not get each other sick. Our citizens have been great. The people of quarantine have willingly done so, and that's what we'll need too. We do things if we need to quarantine places, and if we ever did need to give orders about a school closing or public place, we would do it, and you would see all that coming gradually. But most people do the right thing and stay home when they're sick. So that's the picture of coronavirus right now, and we'll keep you very up to date. And I'll now turn it over to my colleague, who's one of the most amazing, if you don't know it, in Northeast Ohio. Terry Allen is he's a rock star around the country as a health commissioner, and I'd like for him to share with you what it really looks like, because most of the work in public health happens at the local level.
Thank you. I have to tell you, first of all, that's the first time I've ever been called a rock star. I have twin boys, and they would vehemently disagree. They're 18 years old. Thank you. Probably the last. Thank you very much. First, I want to say, Governor DeWine, thank you for being the consummate public health governor. You've supported protecting our kids from tobacco products. You're supporting our work around lead poisoning prevention. You're here today and supporting the work of public health, and that means a lot. It's very gratifying to us and my compatriots around the state of Ohio. So the one thing I will tell you is that state and local health departments are peas and carrots along with CDC. We're like the public health safety forces. We're like a utility. We're like water. We're like electricity. We're here to assist behind the scenes. Risking a football metaphor here in Cleveland, we're like a good defensive back. If we do our job, our name never gets called over the PA system. So that's what you need to know about public health. For Dr. Acton, she's been an incredibly fantastic leader, overbrimming with sincerity, and her support for local public health, her rallying the public health system statewide has been exemplary, and I'm personally very grateful that she's the state health director and that Governor DeWine has chosen her for that position. So what are we doing in local public health? I'm going to talk about 4 things that we do. We identify, we diagnose, we isolate, and we contact trace. So I'm going to talk about those 4 things. You're here in a treatment facility, and Dr. Boutros can explain the great work that goes on here and the fantastic people that work here at Metro. And in Cleveland, we're very fortunate to have a very strong medical system. So let's talk about identify. So Dr. Acton described the fact that we have travelers that are returning from different places. We know who those folks are, working with our state health department and CDC. They're cooling their jets for a couple weeks as they wait through their quarantine period or their isolation period. We watch for symptoms. If need be, if it occurs, there would be a need to then move from that identification process to diagnosis. So they're being watched. We're checking their temperature. We're looking for symptoms, and we're staying in touch. This is happening across the country. It's happening in Ohio. It's happening here now. The diagnosis would mean that if we had a person in particular that started to exhibit symptoms, and based on the case characteristics, that person would need to be tested. We would coordinate with the state health department and CDC and with our hospital systems around the testing, and then those tests would be sent to the state health department and on for confirmation as needed. We also know that if we have people of particular concern, we can isolate those folks or quarantine. People that are specifically at risk can either be isolated or quarantined through different methods, but that's happening now. If we have a traveler that's sick, they're at home. They're not walking around the community exposing people. So that process is taking place. It's important to note that we've been doing this a while. I've been in public health for 30 years, and I was active around the post 9/11 response for anthrax, smallpox. We certainly then had H1N1 response in 2009, 2010. We had the blackout in early 2000 and how we dealt with that around a public health emergency. We remember that. And Ebola in 2014. So there's a lot of experience with understanding the shoe leather public health work. This is what we do. It's in our DNA. The last piece is contact trace. If we identify someone that's ill, and Dr. Acton spoke to this, we're going to identify someone that's ill and then find out who they've been in contact with. This is what we do for things like measles. This is very much part of what public health and medicine does. We look for people that are ill and find out who they've been in contact with and make decisions about whether those folks need to be isolated or tested, as the case may be. So what we're doing now is we are hoping for the very best, but planning in the event that it gets more severe. That's what we need to do because we don't know where this will go. Here locally, it's important, along with the 6 weeks you heard from the State Health Department, it's important to know that we've been working very closely with our partners here.
Called COVID-19, and then there's actually another name for the virus, but most people are still knowing it as coronavirus. So the website is masks that people wear, the surgical masks. They can keep you from coughing. This is spread by respiratory droplets, so it keeps that from going out. It actually, many masks are not small enough and poor to actually keep viruses from coming in. So it's more to keep you from going to other people. Now there's a special mask called N95, and that's what we use medically, and that means it keeps out 95% of viral pathogens. And those are the ones that are crucial. Oh.
Because you want a whole one.
Yes.
N95, and here's a surgical mask.
Okay, so you're seeing, I mean, they even have emoticons now, right? The smiley face has a mask. Have you seen that one? This is the mask that it is wearing. And so, you know, and in many parts of the world, because I'm a global health doctor, people wear these out of politeness. It's not seen polite to be coughing around. You know, we all cough on each other, but in other countries, people are very careful about spreading disease, and so they're using that. You've seen paint masks from the hardware store. Those definitely aren't helping. The N95 is it has to be actually fitted. It's a very exact fitting thing, and if the fit is not right, it also is no longer good. These are essential for our healthcare providers to have. Sometimes masks have been given to family members of a case in some of these first cases because they live at home and they're trying to keep a family member from getting it. But these will be the ones that we see a shortage of, and it's really vitally important then that we keep them for the medical professionals and the real patients who need them. And in addition, we are actually working with hospitals and the CDC is working with all hospitals around the country on how to best conserve these. So it's actually a science to how we use these. And that's why you hear a lot about the masks. Again, for most of us, you know, it is the hand washing and the coughing into your sleeve and not spreading things and staying home and not spreading it to other people. So I hope I did justice. These, yeah, too. And one other thing, the governor, I've talked a lot about, testing is a big issue with this, of course. So, you know, we have a state laboratory, and eventually we will hopefully I've had rumors of the next about week or so have the test in Ohio, so that what happens is when we do get a specimen from the hospital or from a local health department, it comes to my lab and we ship it to CDC, and the turnaround time right now is about 3 to 5 days, and they prioritize those on the riskier cases. And the CDC has actually opened up a second lab, so they're running those pretty quickly. The CDC did try to get these already out to the states, but it's a PCR test and one of the reagents didn't work right, so they had to go back to the vendor who made them and have those redone, and so that's the delay. That will be obviously nicer because we'll be able to know quicker the answers, but we still know them fairly quickly, and to date our 7 people have tested negative. So I think with that, it'd be good to open up to questions.
Be happy to answer any questions.
Dr. Acton, you said WCMH, not WCMH. Do you think it's spread here is inevitable?
So there was a lot of use of the word inevitable yesterday, and the fact is, all along, when you look at a pandemic curve, and then the spread of viruses, it's very, very hard to actually contain them and keep them from spreading. And we've done really a heroic job of doing that, but the goal all along has been to slow down the spread. You know, with the amount of travel we have, and with the infectivity of this disease, it has been suspected all along that it eventually could spread. You never know for sure, but I think we now are seeing that it is in so many countries. And eventually that will spread here in the United States. We will see cases, and we've always assumed we would. But we've done an amazing job, I have to say. Compared to each infectious disease, it gets a little better, and we've done a very good job.
Will we see cases in Ohio?
Well, you know, most likely, eventually, we will. But when, we don't know.
Governor, are you prepared to quarantine off Ohio communities if there's an outbreak of specific?
Oh, I wouldn't want to speculate. That's so far down the path. You know, look, we're going to listen to what the experts tell us. So this is going to be something that any decision about any kind of order coming from the governor is going to be in consultation with the experts. Certainly starting with Dr. Acton. Dr. Acton, you want to make any comment on that?
I think when we think about quarantine, there's a whole range of options, and so I want to try to make you imagine this. You know, most like that first case is in a community. So say it is in Cleveland, and maybe the case had a family member that then gets ill as well and is at school. That school is prepared. They have infectious diseases all the time. They have plans. And we've had several schools close in Ohio just because so many people caught it, and the faculty started getting sick, and there are not enough substitutes, and eventually they close a school. So there's a range of things. Like an individual school could close because it really stays contained to that one school or that one community. What you're speaking of is if we saw multiple cases and widespread in the state all at one time, then we have other decisions we would make about, you know, it might be best if what you see in Japan right now, that all schools close for a while because they really, it's everywhere. They can't say it's one place. So there's a range of options, and we'll deploy them.
But we're not. Look, we're not going to go too far down the path speculating, because again, the facts are going to control what decisions are made. These are decisions that are going to be made based on the facts that we see every single day. And so I can assure you and the people of the state of Ohio that Dr. Acton and I and her team are in contact every single day. Just as important, she's in contact with local authorities, and collaboratively they're going to review the situation every day. So I think it would be very misleading to the public for us to sit up here or stand up here and come up with every conceivable scenario of what we would do under those circumstances. I think we have to let the facts play out.
You know, I think we're always afraid of what we don't know, and a lot of what the governor has been doing over the past month is here we have this virus that, the flu that we know killed 35,000 people in the United States, 61,000 the year before, and we sort of are complacent to that, to the point where we don't think about it. But coronavirus is new, and it's tricky because we learn something new every hour. So that leads to sort of a feeling like this must be something we can't anticipate, and I think that's why. So I'm not saying that people shouldn't be concerned, but I want them to have some sort of context for that concern.
And many, to reemphasize, many of the things that we are recommending, the doctors are recommending, the health authorities are recommending, is also good for the flu. And the flu we know is here, and we know the flu is a killer. So doing these things is the prudent thing to do. It's not an alarmist thing to do. It's not, thinking anything other than let's minimize the risk for every Ohioan. Let's save lives. And by doing these things collectively, we will clearly save lives.
To support Dr. Acton's comments and the governor's comments, a study out of China of 45,000 people showed that 80% of the cases were very mild. So it's important to understand that we start to talk about flu. Who are we most concerned about with flu? Dr. Acton will tell you people with chronic diseases, people with reduced lung function.
Ebola or measles, where we do have that ability to protect the public through quarantine. The state has that ability as well.
Where would you put those folks?
Well, housing and hotels have been used, but we will find housing, and we have resources. I should say that Congress right now is looking at, a special emergency appropriation, and a lot of that funding will be to support, if there was a need for larger quarantine, it would be for housing, for transportation needs, for wraparound like food for people. If someone is quarantined, we are obligated under law to provide for their needs.
Last question, the governor has to go. We'll have some more folks to stay on additional questions to talk about.
We've got, St. Patrick's Day in the primary coming up, where there's obviously going to be a lot of human contact. Do you guys have any kind of plan for that, both locally and statewide?
Well, I think that's a good point. I think I've not talked to the Secretary of State about this, but I would hope that there's an advisory put out as far as sanitation, sanitizers at the polling places across the state of Ohio. Again, these are things that, as we think of them, we're going to add them. I think that's an excellent idea.
Thank you, Governor DeWine.
What about for St. Patrick's Day when you've got thousands?
Every bar should have one, yes.
That's something to end on.
So thank you, Governor. Thank you, Dr. Acton, for coming.
Such an honor.
And thank you all for being here. We're going to stick around. We're going to have some of our medical personnel to answer any additional questions for you. But I want to thank you for being here. And I'm just going to invite our head of quality and our head of infection control to come up if you guys have any questions. Thank you very much.